Did you know that the healthy nuts you snack on could turn harmful depending on what you eat them with? Yes, nuts are packed with nutrients, fiber, and healthy fats, but when combined with certain common foods, they may trigger inflammation, weight gain, or even gut issues. Especially for people over 60, your body's response to food changes, and so does its tolerance. In this video, you'll discover which nut combinations support healing and longevity, and which ones silently damage your health over time. When you find yourself grabbing a small bowl of nuts, the intention is almost always a positive one, a conscious move toward a healthier lifestyle, particularly for seniors dedicated to preserving their energy, autonomy, and zest for life. Nuts have rightfully earned a reputation as nutritional gold mines. While this holds for many varieties, it's crucial to understand that they are not all interchangeable. Certain nuts can insidiously compromise your well-being, elevating dangers such as hepatic stress, erratic blood sugar fluctuations, or even creating adverse interactions with essential medications. In contrast, other nuts function as veritable superfoods, safeguarding your cardiovascular system, fortifying your skeletal structure, and preserving your cognitive sharpness as the years advance. Within this detailed exploration, I will present a straightforward, coherent framework for selecting the nuts that best serve your body's needs while moderating those that could silently work against your health objectives. The goal here is not to completely forbid nuts from your diet. Rather, it is to cultivate a deep understanding of which varieties actively contribute to your wellness goals and which ones might be subtly detracting from them. Upon concluding this, you will possess the clarity to know precisely which nuts deserve a permanent place in your pantry, the safest methods for their consumption, and the profound reasons these selections are vital for your long-term prosperity. Let's examine how these seemingly minor snacks can create a monumental impact for older adults who aspire to flourish throughout their golden years. Nuts are a preferred snack for countless individuals because they are perceived as a wholesome substitute for highly processed items like potato chips or sugary biscuits, and this gut feeling is largely correct. They are brimming with vital nutrients, including beneficial fats, plant-based protein, and essential minerals, which makes them both a convenient and deeply satisfying choice. For seniors, however, the implications of dietary choices are significantly more pronounced. As we get older, our physiological systems metabolize nutrients with changing efficiency, and health issues like hypertension, diabetes, or diminished bone mass become more prevalent. Consuming the inappropriate types of nuts can amplify inflammation, disrupt glycemic control, or conflict with prescribed medications, thereby complicating the management of one's health. Conversely, the right nuts provide a wealth of compounds that actively combat the aging process, shield the brain from cognitive deterioration, and maintain the strength and flexibility of your heart and blood vessels. A landmark 20-year study featured in a prestigious cardiology journal brought to light that one very popular nut could elevate the risk of liver damage by a staggering 48%, whereas others were shown to dramatically reduce the likelihood of heart disease and mental decline. This narrative will meticulously differentiate between the nuts to welcome into your diet and those to handle with caution, empowering you to make daily choices that fortify your health. Consider the humble almond, a genuine champion for the well-being of older adults. These particular nuts represent an outstanding dietary selection due to their rich concentration of nutrients that directly tackle some of the most significant health challenges faced by seniors. A single 1-ounce portion, which equates to a small handful, contains approximately 97 milligrams of calcium, a quantity that rivals what you would get from a quarter cup of milk. This is of paramount importance for preserving bone density and warding off osteoporosis, a debilitating condition that poses an increasing threat as we age. Robust bones are fundamental to maintaining an active and self-sufficient lifestyle, whether your passions lie in gardening, taking long walks, or enjoying time with your grandchildren. What elevates almonds even further is their impressive magnesium content. This mineral operates in a synergistic partnership with calcium, ensuring that the calcium is effectively channeled into your bones instead of accumulating in your arteries or soft tissues, a phenomenon that can heighten cardiovascular risks. This calcium-magnesium synergy functions as a natural protective mechanism for your skeletal integrity, bolstering your bones without endangering your heart. Beyond skeletal health, almonds are loaded with antioxidants, which are particularly concentrated in their delicate brown skins. Here, compounds known as flavonoids join forces with vitamin E to form a formidable barrier against oxidative stress. Oxidative stress is a damaging cellular process instigated by harmful molecules, and it is a key contributor to aging, memory lapses, and a weakened immune response. By combating this process, almonds aid in the protection of your cells, contribute to vibrant skin, and may even help in the preservation of memory function, a critical benefit for seniors determined to remain mentally astute. The vitamin E present in almonds is also instrumental in promoting skin health, assisting you in retaining a youthful complexion and enhancing your skin's resilience to environmental factors. For your cardiovascular system, almonds offer around 9 grams of monounsaturated fats per ounce, the very same type of heart-healthy fats celebrated in olive oil. These beneficial fats work to lower LDL, or bad cholesterol, while simultaneously elevating HDL, or good cholesterol, which helps keep your arteries pliable and supports robust heart function. Furthermore, with 5 grams of dietary fiber in every serving, almonds foster digestive regularity and provide an additional mechanism for controlling cholesterol levels, solidifying their status as an essential daily snack for seniors committed to feeling their absolute best. Another cornerstone of a health-promoting diet for older individuals is the walnut, frequently referred to as the ultimate brain food, and its advantages are truly significant. Its wrinkled, brain-like form is almost a visual cue to its most celebrated role, bolstering cognitive wellness as you navigate the aging process. Just a single ounce of walnuts delivers approximately 5 grams of alpha-linolenic acid ALA, a plant-based omega-3 fatty acid that is indispensable for upholding the structural integrity and fluidity of brain cell membranes. This allows neurons to transmit signals efficiently, a process that is absolutely essential for seniors aiming to preserve mental clarity and swift cognitive processing. Research from a highly regarded university has demonstrated that the omega-3s found in walnuts enhance cognitive flexibility and the speed at which the brain processes information in older adults, thereby helping you stay sharp for everyday activities like managing personal finances or engaging in complex hobbies. This is particularly vital because age-related cognitive decline can begin with subtle changes, but can significantly diminish one's quality of life over the long term. Walnuts are also a source of polyphenols and vitamin E, 2 powerful antioxidants that possess the unique ability to penetrate the blood-brain barrier, which is the selective filter that governs what substances can enter the brain. This special access enables them to directly mitigate inflammation within neural tissues, a primary catalyst for conditions such as Alzheimer's disease and other forms of dementia. Persistent, low-level inflammation in the brain can gradually erode memory and cognitive abilities, but walnuts offer a natural countermeasure, functioning as a protective shield for your mind. A further distinctive advantage of walnuts is their modest content of melatonin, the hormone responsible for regulating our sleep-wake cycles. A great number of seniors contend with disturbed sleep patterns, which can negatively influence mood, daily energy, and mental acuity. By incorporating walnuts into your dietary routine, you may experience an improvement in sleep quality, which consequently supports your overall sense of well-being. Whether you are engrossed in solving puzzles, sharing memories with loved ones, or simply seeking a restorative night's sleep, walnuts represent a simple and palatable method for protecting your brain as you age. Shifting our focus, we find the vibrant pistachio, a small but powerful nut that stands out as a true champion for heart health. With approximately 160 calories per 1 ounce serving, pistachios are a less calorie-dense choice compared to some of their counterparts, yet they deliver a substantial nutritional impact with a well-rounded profile of plant-based protein, beneficial fats, and antioxidants. What renders them particularly beneficial for seniors is their notable potassium content, which is around 285 milligrams per serving. Potassium acts as a powerful countermeasure to the blood pressure elevating effects of dietary sodium, a critical function for older adults who are managing hypertension, a widespread condition in this demographic. Clinical trials documented in a respected nutrition journal have confirmed that regular consumption of pistachios can result in significant decreases in systolic blood pressure, aiding your efforts to maintain your heart in optimal condition. This benefit is especially meaningful for seniors who wish to remain physically active and minimize their risk of serious cardiovascular events like heart attacks or strokes. Pistachios also excel in the realm of blood sugar management, making them an astute selection for the many seniors navigating type 2 diabetes or insulin resistance. Their low glycemic index ensures they do not trigger abrupt surges in blood sugar. Moreover, their combination of protein, fiber, and healthy fats slows down the digestion and absorption of carbohydrates when they are consumed as part of a meal. This helps to avert the post-meal glucose spikes that can lead to feelings of lethargy and contribute to the long-term risks associated with diabetes. Beyond their contributions to heart and blood sugar health, pistachios bolster vision and brain wellness through their high concentrations of lutein and zeaxanthin. These two carotenoids are known to protect the macula, the region of the eye responsible for clear, central vision. These compounds may lower the risk of developing age-related macular degeneration, which is a primary cause of vision loss among older adults. Emerging scientific inquiry also indicates that lutein and zeaxanthin might have a role in preserving mental sharpness, helping you maintain focus and alertness. Pistachios are a versatile, heart-protective snack that can make a substantial positive difference in your daily health regimen. Then there are Brazil nuts, a nut that occupies a unique category, offering profound benefits but demanding extreme caution. These nuts are an unparalleled source of selenium, a trace mineral that has a crucial function in thyroid regulation, immune system strength, and cognitive defense. A single large Brazil nut can contain about 96 micrograms of selenium, an amount that surpasses the recommended daily intake for the majority of older adults. This characteristic transforms Brazil nuts from a simple snack into what is essentially a natural supplement encased in a shell. Selenium is vital for the conversion of the thyroid hormone T4 into its active form, T3, which governs metabolism, energy production, and mood. This is particularly significant for seniors and especially for post-menopausal women who are more susceptible to thyroid imbalances that can manifest as fatigue, unexplained weight gain, or mental fog. By promoting thyroid health, Brazil nuts can help you feel more vibrant and emotionally balanced. Selenium also functions to shield neurons from the damaging effects of oxidative stress, which has been associated with cognitive deterioration. Research indicates that lower selenium levels correlate with poorer memory and cognitive performance in older adults, whereas optimizing selenium intake can foster clearer thinking and greater mood stability. The benefits of Brazil nuts also extend to the immune system, assisting your body in warding off infections and maintaining its resilience. However, their extraordinarily high selenium content necessitates the practice of rigorous portion control. Consuming more than one Brazil nut per day, or two at the absolute maximum, can lead to selenium toxicity. The symptoms of this condition can include fatigue, gastrointestinal distress, brittle nails, hair loss, and even neurological dysfunction. To ensure your safety, it is essential to limit your intake to a single Brazil nut daily. Furthermore, it is always wise to consult with your physician if you are on medications for thyroid conditions, blood pressure, or cholesterol, as certain nuts can have interactions with these treatments. Brazil nuts are a potent addition to a healthy diet, but moderation is the absolute key to unlocking their benefits safely. Having explored the nuts that should be dietary staples, it is equally crucial to identify those that should be consumed with caution or largely avoided, as they can present considerable risks for seniors, particularly for those with pre-existing health conditions or who are taking multiple medications. First on our list of nuts to approach with restraint are peanuts, which, despite their immense popularity, harbor certain hidden risks. In contrast to true tree nuts, peanuts are legumes that mature underground, a growing condition that leaves them susceptible to contamination by molds that generate aflatoxins. These are potent carcinogenic compounds that can inflict damage on liver cells over extended periods. Seniors who have diminished liver function or less efficient detoxification systems are especially susceptible to these toxins, which can also compromise immune function and elevate long-term health dangers. Research from a leading liver health organization emphasizes that even chronic, low-level exposure to aflatoxins can be detrimental. Furthermore, peanuts have a high concentration of omega-6 fatty acids. While not inherently damaging in modest quantities, these fats can foster inflammation when their consumption becomes excessive. Many seniors already have an overabundance of omega-6 in their diets from processed foods, and adding peanuts to the mix can intensify this inflammatory load, potentially exacerbating conditions like arthritis, heart disease, or cognitive decline. For these reasons, it is most prudent to consider peanuts an infrequent indulgence rather than a regular part of your snacking routine. Cashews are another nut to consume in moderation, primarily due to their surprisingly high carbohydrate content. A 1-ounce serving of cashews contains approximately 9 grams of carbohydrates, but only 1 gram of fiber. This ratio means they have the potential to elevate blood sugar levels more rapidly than other types of nuts. This is a significant point of concern for seniors who are managing pre-diabetes or full-blown diabetes, as frequent blood sugar spikes can result in energy slumps and contribute to long-term health complications. Cashews also contain substances known as oxalates. These are naturally occurring compounds that can bind with calcium within the digestive system, which can lead to the formation of kidney stones. For older adults who may have reduced kidney function or a past history of urinary stones, cashews can aggravate these risks, making them a less than ideal selection. While cashews are not intrinsically harmful, their carbohydrate and oxalate profile suggests they should be eaten sparingly, especially if you are closely monitoring your blood sugar or have concerns about your kidney health. The luxurious macadamia nut, while delicious, is another that should be regarded as an infrequent indulgence. They are exceptionally calorie-dense, with a small serving of just 10 to 12 nuts containing around 200 calories, the vast majority of which come from fat. Unlike many other nuts, they provide minimal protein or fiber to help you feel full, which can easily lead to overconsumption and subsequent weight gain, a significant concern for seniors managing their heart health or mobility. Macadamia nuts also possess a high content of saturated fat, nearly 3 to 4 grams per ounce, which can contribute to an increase in LDL cholesterol and potentially worsen existing cardiovascular conditions, particularly for individuals taking statins or other heart-related medications. Their rich, fatty composition can also place a strain on the gallbladder, a common area of concern for seniors, as the incidence of gallstones increases with age. Consuming macadamia nuts in large quantities can provoke digestive discomfort, such as nausea, abdominal pain, or even trigger a gallbladder attack. Consequently, they are best reserved as a rare treat rather than a dietary staple. Finally, we turn to pine nuts, which carry a set of distinct risks that make them worthy of limitation. These small nuts, frequently featured in gourmet cooking, can trigger a peculiar condition known as pine mouth syndrome. This affliction causes a persistent metallic or bitter taste to develop in the mouth 1 to 3 days after their consumption. This unpleasant sensation can linger for days or even weeks, leading to a suppressed appetite and the potential for unintentional weight loss, which is a serious issue for seniors who may already be at risk for undernourishment. More alarmingly, pine nuts contain compounds that might interfere with the efficacy of common medications, including drugs for blood pressure, antidepressants, or cholesterol-lowering treatments. These potential interactions are not widely known, making them a hidden danger for seniors who are on multiple prescriptions. Additionally, the small size and smooth texture of pine nuts make them a significant aspiration hazard, especially for individuals who experience swallowing difficulties or dry mouth as a side effect of medications. If pine nuts are accidentally inhaled, they can obstruct airways or become lodged in the lungs, potentially causing aspiration pneumonia, a very serious infection in older adults. For these collective reasons, pine nuts should be consumed rarely and with a high degree of caution. To translate this knowledge into actionable habits, begin with a straightforward weekly pantry review. Ensure you are well stocked with almonds, walnuts, pistachios, and maintain a strict daily limit of 1 Brazil nut. To manage portion sizes effectively, serve your nuts in a small dish, such as a ramekin. Never eat directly from the bag, as this makes it incredibly easy to consume too much. Designate a separate treat jar. For peanuts, cashews, macadamia nuts, and pine nuts, allowing you to enjoy them sparingly. Store nuts with a high fat content, like walnuts and Brazil nuts, in the refrigerator. This practice prevents them from becoming rancid, as rancid fats can transform beneficial compounds into harmful ones. For Brazil, nuts rigidly adhere to 1 per day, with 2 as the absolute maximum, to prevent any risk of selenium toxicity. Research from a prominent heart health organization has demonstrated that seniors who adhere to structured nutritional frameworks like this one experience superior cardiovascular outcomes, more stable blood sugar levels, and enhanced cognitive function when compared to those who make more arbitrary food choices. Consistency is far more impactful than striving for absolute perfection, so your aim should be to integrate these choices into your regular daily routine. If you are taking medications for blood pressure, diabetes, or thyroid issues, engage in an open dialogue with your doctor about your nut consumption. Certain nuts can either amplify or diminish the effectiveness of medications, and your healthcare provider can assist you in creating a plan that optimizes both your nutrition and your medical treatments. Remember that nuts are one component of a larger mosaic of healthy aging. Collaborate with your doctor or a registered dietitian to develop a holistic nutrition plan that incorporates nuts alongside a variety of other foods that promote bone health, heart function, and cognitive performance. Make it a practice to regularly monitor your blood pressure, blood sugar, and cholesterol levels to observe how your dietary adjustments are influencing your key health markers. Pay close attention to your energy levels, the quality of your sleep, and your mental clarity, as these are real-time feedback on how effectively your food choices are serving you. The snacks you select today can either be building blocks for a strong and healthy future in your golden years, or can quietly undermine decades of effort to maintain your health. Nuts are profoundly powerful foods that can either bolster or subvert your health objectives, all depending on which varieties you choose and how you consume them. The distinction between thriving in your later years and facing preventable health struggles often hinges on simple, well-informed decisions, such as which nuts you choose to keep in your kitchen. You are now equipped with the knowledge to select nuts that actively foster the health of your heart, brain, and overall well-being, while simultaneously limiting those that carry potential risks. Consider sharing this guide with your adult children, grandchildren, neighbors, or any friends who are also striving to make intelligent food choices as they age. Your recommendation could be instrumental in helping them avoid nutritional pitfalls and construct a foundation for a stronger, healthier future. Stay informed, remain prepared, and continue to make the choices that support the vibrant, independent life you so richly deserve. Please note that this information is provided for educational purposes and should not be considered a replacement for personalized medical advice from qualified healthcare professionals who are familiar with your unique health profile.